Well, good morning, ladies and gentlemen. If I can bring this house to order, it's an absolute pleasure to welcome you to this really exciting day. My name is Ian McInnes. I have the privilege of serving as the president of EULAR. And as the day unfolds, we're going to learn a very great deal about how important rheumatic musculoskeletal disease is, which is a bit of a mouthful at this time in the morning. So you'll hear us say the word RMDs quite a lot. It's easier unless you've had a lot of coffee. But it's an absolute pleasure to welcome you all. And if you may be wondering why all the cameras and the waving of hands, we are currently being beamed to all the corners of the earth. Even the Antarctic station is listening carefully to everything that we have to say. So be nice to the penguins, if you would be, please. But that means, of course, every minute is counted for. And so as we go through the day, we will try to keep ourselves as close to the published agenda as we can. Now, it's a very sincere pleasure for me to welcome our guests. We have, you can see sitting on the podium, Ms. Teresa Griffin, who is a member of the European Parliament from the United Kingdom, and Mr. Antonio Camerato, who's the team leader for the Advisory Committee on Safety and Health in the Workplace from the European Commission. And to both of you, we extend our very sincere words of welcome. We'll also be joined momentarily from the ether by Ms. Roberta Metsola, who's a member of the European Parliament from Malta. She couldn't bring herself from the sunshine of Malta to the gentle Glaswegian rain of Brussels. I've no idea why, but anyway, she has sent a lovely message to us, and we'll hear that momentarily. And she's a particularly interesting view. She is the chair of the European Parliament Interest Group on RMDs, and as I say, you'll be very interested to hear what she has to say. Now, this opening session is really an opportunity for us to convey to you the key messages that are driving us in EULAR and per EULAR, this community of remarkable people who are interested in defeating the RMDs. Professionals, health professionals, doctors, policymakers, most importantly, people with RMDs. We were discussing last night, we don't like the word patient very much. This is people who happen to have a disease rather than people who have become patients. This is a slide to remind me who I am. This is because the organizers of the Congress are very well aware of my amnesia and short-term memory problems. So I remain Ian McInnes. Most of you are very familiar with what the RMDs are. They comprise actually an enormous group of conditions, almost 200. But they have, as a common focus, impact on the mobility, well-being, quality of life, duration of life on the individual. They impact their families. They impact society around them. They impact the economic and social inclusion of those individuals and their families affected. In 2020, that is unacceptable. That's why we're here, ladies and gentlemen. We wish to make that message as clear as we possibly can to our policymakers, our friends in a variety of governments, both national and here transnational across Europe. The numbers on this slide are probably well known to you, but they're pretty sobering indeed. A quarter of people will have an RMD. This is the #1 cause of physical disability in Europe. Imagine the loss of creativity and productivity in a quarter of the population suffering from these conditions. It really does give us pause for thought. World Arthritis Day. Actually, we celebrating this remarkable gathering of people who share this commitment, share this idea, share this notion that defeating RMDs is absolutely a priority. We see stakeholders, patients, people with disease, and all of the other policymakers who are both in the room and we hope listening. We are streaming live, and we hope that those messages will go as clearly over the airwaves as they do in this room together as we share community. We're going to focus on a number of policy documents as we go through, and the workshops and the time we spend together will highlight those. I won't dwell on them this morning. What I'd like to do, we want to bring a whole variety of people together. We have a conference today, which is just the beginning We want to contribute, of course, to EU public health. We see health as a continuum with the entirety and totality of society. Health doesn't sit outside policy. Health sits at its very core. This is something that I shall come back to. That, in turn, has the consequence of bringing people with chronic diseases, of which RMDs are a significant majority, back into the community, instead of leaving them ostracized and lonely at the edge. We will all win, and we will come through a whole variety of recommendations as we go through. I'd like now to introduce Roberta Metsola electronically. There are a number of things that have to happen here. The most important one is I have to succeed electronically. This rarely happens.
Unfortunately, I'm not able to be present today. I nevertheless wish you a very successful conference, and I'm looking forward to working with you in this very important field. I am addressing you in my capacity as Chair of European Parliament's Interest Group on Rheumatic and Musculoskeletal Diseases. I took over this function in 2014 because I wanted to contribute to improving the lives of the 120 million Europeans affected by one of these conditions at some point in their lives. In the parliamentary term, which has just started, I'm committed to take our joint work to the next stage, and can also do this as part of my new function as a member of the Environment and Health Committee in this Parliament. There is a need for a stronger role of the European Union in fighting against RMDs and other chronic diseases. We know that rheumatic and musculoskeletal diseases are prevalent amongst older members of Europe's population. We also know that in these cases, such diseases are associated with a loss of independence and the need for more community support or admission to residential care. The share of the population aged 65 years and over is increasing in every member state, with Malta, my home country, registering the highest increase within the last decade. High-quality medical research is the key to effectively treating such diseases, and the European Union must prioritise RMD if it is to ensure high quality of life and an active lifestyle. Medical research and innovation are critical to improving common understanding of the triggers, characteristics and symptoms of RMD. EULAR already plays an important role in promoting medical research through a number of active research centres that it maintains across Europe. And it is at this point that the European Union can make a difference. The European Commission's health programmes run for a period of approximately 6 years, which is useful for long-term planning and coordination, which this sector currently regrettably lacks. The European Commission has supported research in this area through many initiatives. Prominent amongst these is the Innovative Medicines Initiative, the world's largest public-private initiative in this field, with an allocation of 3.3 billion euros between 2014 and 2024. This is good, but there is so much more that has yet to be done. RMDs represent 60% of health problems at work and is the main health-related cause of productivity loss, absenteeism and premature retirement. In times when member states discuss the sustainability of their health and social systems, big gains can be made having a systematic approach to RMDs in particular. We should furthermore work together with the social partners, payers and providers on a European strategy to address RMDs. There is the need to promote outcome-based healthcare, focusing on quality of life and integration in social and economic life, including the return to work. There is also a need to better integrate health in other policy areas, in particular employment and social affairs. Only so, through such a health in all policy, tangible outcomes for patients and citizens can be achieved. So I would like to thank the EULAR Brussels office for their efficiency supporting the Parliamentary Interest Group. I will make sure that we discuss and promote parliamentary activities aiming to improve the EU reaction to the growing burden of RMDs in the coming years. Thank you, and once again, good luck.
Thank you very much indeed. In absentia, Roberta, powerful words indeed. And you will notice, I hope, for the purposes of my children who believe me to be IT incompetent, that I both put a video on and put it off in a timely manner. Let us celebrate these minor miracles of modern intellectual and technical science. It's a real pleasure now to welcome Ms. Teresa Griffin to the podium. It turns out that Teresa and I share Irish and Scottish Celtic origins.
We do.
Although you landed up in Liverpool, that fine musical city. Teresa, it's an absolute pleasure to have you joining us. We look forward to hearing your remarks.
Thank you.
I give you the podium.
somebody give me a mic? I love technicians. I could never exist without technicians. Okay. Live stream now? It's working? Yeah? Okay. Good. I'm absolutely delighted to be here. I hope that you think this is a great frock. Dress, maybe in other languages. In Liverpool, we call it a frock. In Glasgow, they call it a frock. Do they not? In Ireland, they call it a frock. Great frock. I refuse to wear boring suits as a member of the European Parliament. We've got to be out there. Can I show you what's wrong with this frock? I'm going to turn around, and actually, this is quite brave. Okay, I'm going to turn around. Can anybody see what's wrong with this frock? Anybody? It's not done up at the back. Why is it not done up at the back? Because it takes me an hour and a half in the morning to use my hands. I am a member of the European Parliament with the privilege to represent the northwest of England, to chair Labour MEPs in the European Parliament, and I have chronic rheumatoid arthritis in 85% of my body. So what do I have to do when I walk into the European Parliament in the morning? I have to say, hey, could you just help me to do up my frock? And that might sound that I'm being trivial, but that's the reality that we face every day. In the European Parliament, there are escalators. The European Parliament is great in terms of access, but there's escalators. And does anybody else out here, like me, have to judge when you put your foot on the first rung of an escalator and have to watch your body go up? Because you can't move as fast as an escalator. You have to judge it. And when I first got elected, wonderful, wonderful thing. When I first got elected, I was asked to speak at the National Conference of Unison, which is a very big public sector union in the UK. And my only comment about Brexit is the people that will be worst affected by Brexit are low-paid part-time women. What is the UK doing? It's a disgrace. But anyway, so I'm in St Pancras Station, off to speak at this large conference. And I'm going down an escalator and judging, as you do, whether you can get on it or not. I'm seeing people nodding. Other people understand this. Great. Okay. So I'm judging, going to speak at a conference, just having been elected to represent 7.1 million people in the European Parliament. What a privilege is that? How good is that? So I'm judging to go and speak at this conference in front of thousands of people. And quite frankly, I'm terrified. And as I'm doing this, going down the escalator, this woman comes past me and she says, "Stop, I'm very important and you are slowing me down." So to everybody who has got a mobility issue in the world, we are important and nobody should slow us down. Now I'll go on script. You're taller than me. And I hope one of the sisters out there will do up my frock before I go into the European Parliament, because I've actually got to go and vote. Okay, so thank you. Delighted to be here. Even though living with arthritis can be a challenge, it's actually got to be about making society work for us. Actually, I'm going to throw this away. But thank you. I come from a working class background, so I haven't got the confidence to speak without a script because it's like my backup. I also haven't got the confidence to speak without red lipstick because, hey, if you can't move your legs, you might as well have red lippy on, but there you go. But seriously, it's about making the world work for us. It's about bringing the research environment. It's about bringing us together that live with this condition. It's about making the budgets of the European Parliament actually work in terms of health research. I have the privilege at the minute of leading for my group, which is the Social and Democrats on Horizon Europe, which is the large research and development budget. And the thing about Horizon is it's long-term research, because as we know, in order to get investment from a bank, you normally have to prove capitalisation within 7 years. How can we find cures? How can we find long-term medicines? How can we get early diagnosis in 7 years? We can't. We need long-term health research. And to my friend from Glasgow and Ireland and Liverpool, I think, we have to make sure that health is part of all of the R&D budgets of the European Parliament. And I lead on industry. I lead on energy. I lead on energy poverty and industrialisation, but I can tell you that I put health and the implications on all policy on health into every piece of legislation that I am part of. We are talking now about a just transition, and that means healthy environment. That means the move from fossil fuels to renewables. Just transition means that we cannot leave any community behind. So it means that we invest in reskilling and upskilling workers in industries in transition now, not when those industries have declined. My own dad was made redundant. He was a car factory worker. He was a machinist. He did that for 35 years with no ear defenders. Come on, team. He was made redundant when I was 14 and a half because of the mass car factory closures in the UK. He didn't get a job again until I was 17 and a half. And then, God bless him, he got a job on the buildings. This shouldn't ever happen in any industry again. Nobody should be left behind. And that's about creative education for our 3-year-old girls now. And why does this matter? Why am I talking about energy and the shift from fossil fuels to renewables? It's because we need clean air. It's because fossil fuels are linked to childhood asthma. It's because every industrial policy should have health at its core. Because as you know, and as I know, if suddenly, as a legislator in the European Parliament, you can't use your hands and you can't sign off a piece of law, it impacts not only upon you, but on your family, your daughters, your sons, your nieces, your nephews, not being able to pick up a little toddler who reaches for you as their auntie, and you can't get down, and you can't pick them up, and you can't explain to that 2-year-old why you can't do this. This is really crucial, that we bond together, that we stand, sit. I have to mention Mandy Colleran. Anybody look at her on social media, she's called Disability Diva. She's been one of my best friends for 30 years, and she is a permanent wheelchair user because she's got brittle bone disease. So in the UK and across Europe, sorry, I'm being very northern, we have something called stand-up comedians. Does people know that, when people go and do stand-up? So my friend Mandy is a sit-down comedian. And she's absolutely fabulous. And still in Liverpool, and it's still in Brussels, and I'm sure it's still in Glasgow. And what countries have we got represented here? Have we got anybody from Latvia? Malta? Great. Spain? Italy? Germany? Ireland? Portugal? What have I missed? Come on. Romania. I love Romania. Bulgaria. Denmark. Hungary. Cyprus. And Belgium. So we are truly, truly international. We have to change the world together, and it's about all of you having your voices. It's about changing society so it works for us. And I'm having a really interesting altercation with Eurostar at the minute. I don't know if people use Eurostar, but they have got a security ramp that you have to lift your case onto. There isn't a ramp that comes down onto the floor. And I happen to believe that everybody that wants to travel independently, and I've written legislation on this, and it will come into force, sadly, maybe after the UK is out of the European Parliament, but I hope it benefits all of the rest of the countries here, that everybody should be enabled to travel independently if they wish to. If they want to seek assistance, absolutely. But actually, the buildings, the places, the spaces should be made for us to enable us if we are wheelchair users, if we can't use our hands, if we can't see properly. While I'm at it, I'll go on. Airports around the country of Europe at the moment are moving to having the announcements made about your flights only on screens. A lot of airports now don't announce flights. You have to look at the screens. What happens if you're visually impaired? What's that about? And finally, because I'm really sorry, I've got to go back to the European Parliament, but I'm going to get all of this back from you because I will take what you say and learn from it. Finally, Thon Hotel. What's that about? I don't know about you. I couldn't use this to save my life. Have a great day. I'm delighted to be here, and thank you for your time.
Teresa, thank you so much. That was both inspiring, mildly amusing for a Liverpudlian, and absolutely on point. Thank you so much. It's now a real pleasure for me to introduce Antonio, who's going to give us a perspective, particularly around policy from the European Commission. So, Antonio, the floor is yours.
On the okay, good. Okay, thank you very much. Okay, good morning to all of you. And first of all, let me say this is the second time that I have the pleasure to attend one of these events, of this important EULAR conference. I was here in 2016 for the first time, and I can remember about a very interesting discussion with colleagues, with participants, with members of the European Parliament. So I think that we will have something very similar today. And I would also express my thankfulness to the organizers, to EULAR, for inviting DG Employment, Commission DG Employment, I understand that this is a very important point on the agenda today, to make sure that we can promote a very good coordination and connection between health policy, public health policy, and social policy in the European Union. Of course, I will, for the time being, I will represent the point of view of DG Employment, of social policy on the issue, but I'm fully aware that there are lots of other important aspects that need to be taken into account and need to be coordinated when we talk about the European Union scenario on ergonomics risk at the workplace. As usual, I would like to enter into the topic with a number of figures and most recently, say, results from surveys or analysis on the problem. What you can say there are data from the European Working Conditions Survey from Eurofound in Dublin, and they date back to 2015. As you can see, exposure to economic risk is the most prevalent, let's say, concern in Europe today. Of course, we know that ergonomic risk are the principal, the most important responsible cause for work-related musculoskeletal disorders. 61%, about 61% of workers report exposure to ergonomic risk. We're talking about vibration, tiring position, lifting people, carrying heavy loads, and repetitive movements. In terms of occupation, there are some categories of workers that are particularly touched by this or more exposed to ergonomic risk: craft workers, plant and machine operators, agricultural workers, and these are the occupations with the highest level of exposure. As I said, the most important, the most relevant consequences of exposure to ergonomic risk are work-related musculoskeletal disorders. Of course, you know very well, we know all very well that musculoskeletal disorders can occur also outside the working life, but of course we have to consider that working life can make it worse, can in some cases also originate directly the problem. And from the point of view of social policy, European social policy, you know, we work on the principle of prevention, and that means that we are interested, first of all, to reduce as far as possible all risk at the workplace that could be originating this kind of problems. It goes without saying, work-related musculoskeletal disorders affect both women and men in all sectors of activity, and they are, of course, a major cost burden for business and society. This data are data from, let's say, surveys and statistics which date back to the beginning of this decade, more or less, and they tell us that work-related musculoskeletal disorders represent about 60% of all work-related health problems, account for 60% of all sickness absences in the EU, and also for about 60% of all cases of permanent incapacity to work. At least 11 million workers are affected. That means 5% of the total EU working population, which is really a huge figure. This data as well, they are data coming out from a study contracted out by the Commission in 2011 in the framework of the preparation of a possible new legislative initiative on ergonomics. Some of you could be aware of with this let's say, effort that we carried out in the past without success, I would say, but some important data are there coming out from this experience, and they tell us that work-related musculoskeletal disorders, the cost of these diseases can be estimated at over 163 billion euros on a 2-year basis. And the costs are then shared by employers, 33% with, of course, productivity losses and turnover costs, workers much of all, 65% in terms of income, health-related quality of life losses, and of course public authority, 2% impact on GDP when it comes to, of course, intervene with social assistance and health assistance. Let's have a very brief overview of what are the main important legal means in the hand of the European legislator and of course of the the member states legislators. We have an important EU legal framework. First of all, we have the framework directive 89/391, and there is an article 6.2d, which states explicitly that the ergonomic principle of adapting the work to the individual. In general terms, I must say that the framework directive, as you know very well, it's a directive that puts some obligations, very clear obligations to employers, and that means that the employers are expected to conduct risk assessment on all risk at the workplace. That means that in principle also economic risks are generally covered by the framework directive. In the course of the year, over here, as you can see, the European legislator has produced other directives more specifically focused on specific aspects of the ergonomic risk, on manual handling of loads, on the work with display screen equipment, and on vibration. There are also other directives that have impact, workplace, of course, work equipment, personal protective equipment, and also directives on machinery, which is not directly related to social policy, but as some aspects that have an impact on that, because of course they lay down important provisions regarding the safety level in machinery production. An important thing, most recent thing, is the conclusions that we came out from the ex-post evaluation of the OSHA key. Most of you can be aware that the European Commission carried out an important ex-post evaluation exercise on a large part of the European legislation, the so-called refit exercise at the beginning of this decade, and the conclusion regarding in particular legislation on ergonomics is that, of course, there is a general agreement on the fact that this is a complex issue, and that also it was also recognized that part of the risk currently covered by the legislation on ergonomics, in particular manual handling of loads and display screen equipments, are not the only risk that, let's say, make up the general framework of ergonomics risk. What can we do? Of course, the first immediate reaction would be then we need to have a new legislation on ergonomics, and that's, as I said earlier on, is something that we have also considered in the past. But it's also true that we have also we have to recognize two important things. First of all, that there is an important, let's say, loss of consensus on such initiative. In the past, we had very strong support from some part of the political spectrum, but also very significant resistance, of course. So it makes things difficult. And on the other hand, due to the complexity and multifactorial nature of the problem, it's probably we need probably to tell ourselves that the legislative route may not be the most appropriate way to tackle the problem of all the risk factors when we come to discuss on ergonomics. So probably, and this is what we are doing, we will come back to that very soon. We are producing a lot of guidance and awareness raising tools to let's say, promote the discussion and see how we can better tackle the problem. This is also important. This is also a consequence of the EU OSHA, of the ex post evaluation of the OSHA key on health and safety. A communication from the Commission adopted in 2017. This is safer and healthy work for all. Also includes within a broader program of update of directives, the possibility to update one of the ergonomic directives, that means the DSE directive, the Display Screen Equipment Directive. For the time being, no final decision has been taken on that, but it is possible, probably a new working party within the Advisory Committee on Safety and Health at Work, which is a tripartite, the most important tripartite consultative body in the area of health and safety, may be set up to further explore the issue. No regulatory initiatives. I was mentioning that there are a number of important things that have been done at European level. Of course, campaigns, first of all. EU OSHA, the Bilbao Agency for Safety and Health at Work, carried out campaigns on ergonomics in 2000, 2007, and is going to launch the new campaign 2020-2022 on ergonomics. The SLIC as well carried out campaigns in 2017, the biannual campaign on ergonomics in the construction sector in particular. Now they are going to carry out in parallel with the initiative from EU OSHA its own campaign. Guidance is also an important aspect. I mentioned here two most recent results of this effort at European level from EU OSHA and from SLIC as well. Regarding the general trends, when I talk about past trends, I do that because these are data which are not very much updated, are from 2009, but are for the time being the only one available in terms of comparison of what is happening at European level. And the results from the 2009 scoreboard of the VOSH strategy 2007-2012 show that at that point in time, there was a decreasing rates in only 5 member states. 2 member states show stable rates, and the remaining show consistently increasing trends as regards work-related musculoskeletal disorders. Future trends. I suppose that this is nothing at all new for you. Demographic change, changes the sectorial composition of European economies with an increasing share of people working in services, and all these would also entail a different prevalence in exposure to risk. For example, repetitive work are going to be and are already the most important risk factor. So, of course, as I said, we are asking ourselves whether we need to improve, to change something, to update something. And the reason is clear, because given the current level of prevalence and the dynamic of future trends, it is unlikely that the problem can be substantially reduced without additional action. It's clear that the topic will continue to be crucial also in the framework of future new Commission OSH initiatives. New initiatives in this area for the time being, I would say, are most promising in the sense of promoting a better synergy between European Union and national initiative, and also puts stronger emphasis on assistance for better implementation and enforcement. What we are actually doing for the time being, and we want to continue to do in the future. And I thank you for your attention.
Thank you, Antonio, for these really salient and, I have to say, eye-catching statistics. This is an increasing problem. It's not going away, despite our obvious awareness of the challenge. It's for that reason that EULAR set amongst its 2023 strategic priorities work for people with RMDs as an absolute priority, and that is one of our main missions in our Congress today. And thank you, Antonio, you've done a better job than I ever could for setting out the reason for that EULAR priority. And EULAR, through its activities in assisting and providing evidence to support policy, and indeed directly contributing to policy here and across Europe within member states, it's particularly helpful to have so many presidents of our national societies here, both medical professional, health professional, and PARE, patient groups. Together, working at the member state level and across EU, we can really enact change. But that change is particularly important at the moment because we're at the beginning of a new cycle, new MEPs who need to hear this message loud and clear, that the RMDs are a pivotal and critical part of the health of all of our nations. Now, a few housekeeping remarks. Unlike Teresa, I do need notes to remind me about housekeeping, but I don't wear red lippy, just in case you were wondering. Some of you may have been wondering. That goes down very badly in Glasgow, I have to say. This is the structure of our conference. For those of you wondering, we're just about here. We'll have a short video, a few more remarks about our vision, and then we will have keynote speeches. And then you'll be delighted to know, have coffee, lunch, and coffee. Generally, I would have put that in bold and everything else in faint, because that's generally how I structure my day. I stagger from coffee to lunch to coffee, and so too will you, stagger being the operative word. There are going to be workshops. I'll tell you all about that momentarily. These are opportunities for us to share ideas and take ideas back. This is sharing and listening. Part of our purpose in being together today is to learn from each other and to set the necessary understanding of the challenges and the problems that we all face together in context so that we in turn can inform policy. I've mentioned already we are streaming and there are photographs being taken. Now, we're very conscious that some people prefer not to appear in photographs and streaming. If that is the case, can I ask that you sit a little closer to the back of the hall? If your agent told you to, can you make sure that you're sitting at the right angle so that your profile is caught at its perfect space? And if you're very uncomfortable, simply wear shades. That's usually what I do. But I smile, but we're very conscious that some people prefer this not. So if you have a concern about video or photographic images, please let our organizing team know, and we will ensure that those images are removed. So please do let us know in due course. And social media. Sadly, I have absolutely no idea what a Twitter handle is, although I believe I have one. It's what the milk cup didn't have, as far as I can see from Teresa's remarks. We are on Facebook. We are on live stream. This is the hashtag, which all of you who understand Twitter will know that you should by now be using liberally and copiously. And if I can recommend you send these especially to your friends who work in the cardiovascular, cancer and infectious diseases world, I think they would very much welcome this little bit of education today. And something called Slido, you're going to be exposed to this later on. This is an app that allows us all to contribute opinions and will generate a synthesis of ideas, and we will be coming to that later on in the afternoon. So can I ask you please in the meantime simply to download Slido, sli.do. Download it onto your phone or your iPad or your papyrus script. If you don't have a phone or an iPad, find a friend, use it with them. So it's www.slido.com. Pull the app down and be prepared for this afternoon. If you didn't get it all now, you can get it at lunchtime, so you're ready. Now, this is a little video. So we have these strategic priorities. We have EULAR sitting at the very center of the RMD initiatives right across Europe within member states and at the transnational level. This is really what the Arthritis Day is all about.